Hey, Sierra, palping nurse practitioner student doing final exam head to toe assessment. Hello, my name's Sierra. I'm going to be your nurse practitioner student doing your head to toe assessment. Can you tell me your name and date of birth?
My name is RJ, 0529 1990.
Perfect. As RJ entered the room, I did check for his gait. His balance was steady. His gait was even. He had dressed appropriately for the weather. His facial expression is appropriate for medication. As you're sitting here, I am looking at your skin, and it does look like the appropriate color for your ethnicity. There's no lesions, no scarring. Hair distribution is even and appropriate. Skin is warm and dry. Extremities are equal to the core. We're going to start by assessing your head and neck. So your head is normal cephalic. It sits up on your neck properly. It's midline. There's no lesions or abnormalities in the skin, on your face, or in your hair. I'm just going to kind of inspect the scalp first. All right, now I'm going to palpate. Is there any tenderness?
No.
No tenderness, and the scalp moves freely. I'm going to check for the facial bones. Okay, no tenderness?
No.
All right, we're going to check cranial nerve number 2, where you have your corrective lenses on. It's now 9 sharp or about 6 feet away. Can you read for me the line that's most comfortable? Cover your left eye and read with your right.
LTFPH.
And cover the other eye. And read.
LTFPH.
And use both eyes.
LTFPH.
Perfect. Vision is 20/20. Cranial nerve number 2 is intact. You can remove your glasses slowly, sir. Uh-oh. We'll set them aside. I'm looking at your eyebrows. They're even. Hair is coarse and dark. Eyelashes are present on the top and bottom. There's no drainage from your eyes. The sclera is white. Conjunctivis pink. Look up. Look down. Perfect. I'm just going to press for your lacrimal ducts. Any tenderness?
No, ma'am.
Okay. Assess your sinuses. Any tenderness there?
No, ma'am.
Any tenderness?
No, ma'am.
Perfect. We're going to go ahead and check your pupillary reaction to light. We're going to do direct and also consensual. So if you look at my nose, I'm going to shine a light and just look for your pupil to constrict rather. Perfect. And then I'm going to shine a light and look for the opposing pupil to constrict. Perfect. Pupils do constrict to direct and consensual light. I'm going to go ahead and check your red light reflex. Red light reflex is present. Now we're checking for the fundus. Okay. Checking for your fundal margins, and there's also no signs of hemorrhaging or anything like that in the capillaries in your eye. Red light reflex is intact. Checking for your fundal margins. And there's no signs of hemorrhage. I'm going to have you follow my pen light. We're going to check cranial nerves number 3, 4, and 6. They're your extraocular movements. So just follow the light with your eyes only. Keep your head still. I'm going to check for your peripheral vision as well. So tell me when you can see my hands.
No. No. No.
Perfect. And then tell me how many fingers I'm holding up.
2. 1. 2. 1. 2.
Okay, and we're going to do the cover uncover test. And we're checking for strabismus. So can you cover one of your eyes, please? The other eye, just look over my shoulder and object, and we're going to remove your hand. And there's no strabismus noted. And can you cover your left eye and do the same? And remove. Perfect. No strabismus noted. All right, and we're going to go on to your ear exam. I'm just looking, and your outer canthus is even with the upper portion of your ears. Looking for any redness or drainage or exudate in the external ear. I'm going to palpate for any tenderness in the pinna and the targus. Okay, any tenderness there? Perfect. Okay, we're going to go ahead and look in the ear, starting with the right ear. Okay, we're going to get the largest size appropriate for your comfort. I'm going to pull your pinna up and back. And I'm going to stabilize my otoscope. And there is some minimal cerumen present. Tympanic membrane is gray and pearly with a light reflex at 5 o'clock. And we're going to come around to the left ear and do the same thing for your pin up and back. There's no foreign bodies. There is moderate exudate present. And the tympanic membrane is pearly gray with a light reflex at 7 o'clock. If you could look to your left, I'm going to whisper 3 things. Can you tell me what they are?
1, 2, 3.
Perfect. And look to your right.
4, 5, 6.
Now we're going to do the rubber and the rhymes test. We're going to just make sure that you hear vibration in both of your ears. I'm going to place the tuning fork on your head.
Yes.
Okay, perfect. And now the rhymes test, we want to make sure that air conduction is twice as long as bone conduction. And we're going to go to your mastoid process. Tell me when you no longer hear the vibration.
No.
Okay. And
No.
perfect. And the same, we're going to go to your mastoid process.
No.
Perfect. Air conduction is greater than bone conduction. Now I would like to move down to your nose. I'm just checking your external nerves, and we will check for patency. There's no abnormalities in the external area. Blow out, blow out. The nerves are painted. I would also like to check for your cranial nerve number 1. If you can close your eyes, we're going to check for your sense of smell. Smell anything?
Alcohol swab.
Perfect. Cranial nerve number 1 is intact, your olfactory nerve. Now we're going to go ahead and take a look up your nose. And we're going to look for your any deviation in the septum, which it's not. The nose is pink and moist. There's no exudate or no lesions in the nose. No swelling. We're going to go ahead and move on to your lips. I'm going to wash my hands and put some gloves on. I'm looking at your external lips, and there's no cracking or abnormalities. And we're going to go ahead and check for your gums. Teeth are well approximated to the gums. There's no lesions or abnormalities. The mucosa is pink and it's moist. We're going to go ahead and check for cranial nerves number 9 and 10, your gag reflex, and we're also going to look for the rise of your uvula to be midline and non-deviated. Can you stick your tongue out? Say ah. Okay, uvula rises midline and gag reflex is intact. Can you stick your tongue all the way out? We're going to check for cranial nerve number 12. Can you move it from side to side? Okay. And then we're going to check for straight. Can you push against my tongue and push against? And can you lift your tongue up? Check underneath. All right, stick it out. There's no lesions or abnormalities on the tongue. The tongue is moist. Perfect. Now we're going to go ahead and assess for your neck. Actually, while we're here, we'll actually do the trigeminal nerve, okay? And then we'll do your facial nerve as well. So what I want you to do is close your eyes and just tell me where I'm touching.
Above right eye. Above the left eye. Nose. Chin. Right cheek. Left cheek.
And then can you tell me dull or sharp?
Sharp. Sharp. Dull. 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 Sharp.
Sharp. And then if you could, puff your cheeks out. Okay, get a big smile for me. Okay, can you squint your eyes? Can you open your eyes real big? And then can you open and close? We're going to palpate for your master strength and also for your TMJ. Can you push against my hands? Push against my hands and push against my hands. That's cranial nerve number 11. Alrighty, so onto your neck, we're going to check your range of motion. Can you do your ear down to to your shoulder on either side, your chin to your chest, and your head back. Perfect. I don't see any borders or any swelling in the neck. I am going to go ahead and palpate your carotid pulses one at a time. And then I'm also checking for the placement of the trachea. The trachea is midline. I'm going to palpate the carotid notch here. And also the thyroid cartilage. Perfect. And I'm going to go around back and we're going to palpate the thyroid as well. I'll have you lean slightly forward and swallow. Perfect. Thyroid's non-palpable. There's no deviation with the trachea. While I'm back here, we'll go ahead and do the assessment of your posterior thorax. Just looking at your skin as well to do your overall skin assessment and looking at your rate and depth of breathing. Also looking for any retractions. And I don't see any. I'm going to check for CVA tenderness. If you could tell me if this is tender.
No.
Okay.
No.
Okay, perfect. I'm going to palpate. Can you say 99?
99. 99. 99. 99.
Could you breathe in and out? Perfect. We're just checking for any expansion. All right. And I am going to percuss. Okay. And we're going to check for your diaphragmatic exertion bilaterally. So what I want you to do is breathe in and breathe out and hold it, please. Okay. And release. So I want you to breathe in and out and then take a breath in and release. Perfect. Okay. So we got 4.5 centimeters and we'll do the same on the left. I want you to breathe in and out and hold it. Okay. And breathe normally. And then I'll have you take a breath in and hold it when you're ready. Okay. And diaphragmatic excursion is about 4.5 centimeters bilaterally. I'm going to go ahead and also take in all your lung fields for a full breath cycle in and out. Can you breathe in and out? Breathe in and out. And I'm going to listen to your left, right middle lobe under the axillary. Perfect. Okay, we're going to come and do the posterior assessment. I'd like to listen to your carotids for any bruise. Perfect. And I'm just inspecting the interior chest for any abnormalities, any thrills, any heaves of the heart. I'm also looking for any retractions for the lungs. I'm going to palpate for tactile firmness. Can you say 99?
99. 99. 99.
Okay, now I'm going to palpate. Okay, for any heaves or lifts or abnormalities, any thrills, point of maximal impulse. All right, I'm going to listen to your lungs anteriorly for full breath cycles. Can you breathe in and out? In and out. In and out. Okay, we're going to listen to your heart, aortic, pulmonic, Herb's point, tricuspid, mitral, and we're going to do the bell of the stethoscope as well. Aortic, pulmonic, Herb's point, mitral, tricuspid and mitral. And then if you lean forward for me, I'm going to assess, take a breath in and out and hold it. Listening for any aortic murmurs, which are not present. Now I'd like to palpate your lymph nodes. We got preauricular, postauricular, occipital, tonsillar, submaxillary, submental, anterior cervical chain, deep cervical chain, supraclavicular, and infraclavicular. We'll also palpate for your central nodes, your axillary nodes, your scapular nodes, and this is part of your breast exam. We'll go up and into the axilla. Is there any tenderness here? Okay. Go up and into the axilla. Wonderful. While we're here, I'm going to continue to inspect you. So I do want to check your capillary refill, check your nails. Capillary refill is less than 2 seconds. Placement. So what I'm going to do is move your finger up and down. Now can you close your eyes and tell me, is it up or down?
Down.
Up or down?
Up.
Okay, same thing. Move it up and down. Can you tell me, is it up or down?
Down. Up.
Perfect. We're just checking the range of motion in your wrist. Okay, can you squeeze my hands? Perfect. Strength is equal. It's a 5. I'm just checking for any tenderness in the joints. And we're going to do flexion and extension of the arms, and then abduction and abduction of the shoulders, adduction and abduction. And can you roll your shoulders? Perfect. Palpate your pulses. Radial pulses are equal to plus, and we'll do brachial. Right. I'm going to do your reflex as well. And then we'll go ahead and do your reflexes here. We'll check your plantar reflex. All right. And while we're here, we'll go ahead and palpate your pulses. Popliteal, posterior tibialis, dorsalis pedis, and checking your capillary refill in your toes, less than 2 seconds. We're going to lift your toe up and down. Go ahead and close your eyes and tell me, is it up or down?
Up.
Up or down?
Down.
Okay. Same thing. Going to go up and down and close your eyes and tell me, is it up or down?
Up.
Okay.
Down.
Okay, perfect. And then we're going to check the range of motion in your feet and your ankles. Can you just move your ankles around and can you push against my hands? Okay, and push down. Okay, dorsal and plantar flexion. And we're going to check for vibration. Your ankle.
Yes, I feel it.
Okay. Tell me if you
Feel it.
Do you feel it in your toes? And
Yes.
your feet? Okay.
Yes.
Your hands.
Yes. Yep. Yes.
All right. I'm going to have you close your eyes. I'm going to write something in your hand. Can you tell me what it is I'm writing? Which
Right
hand?
hand.
Okay. And then the same for the left.
8 in left hand.
Oh, sorry, I didn't mean to say that. And then can you close your eyes? And I'm going to give you an object. Can you tell me what it is?
Alcohol swab.
Okay. And I'll give you another object. Can you tell me what it is?
Alcohol swab.
What hand?
Left hand.
Okay, perfect. So I think you can go ahead and lay down. And we're going to do your breast exam, your abdominal exam. We'll finish checking your range of motion. Also finish listening to your heart for any aortic murmur. So while you're lying here, I can see that your breasts are even in their midline. There's no drainage. There's no dimpling. The breasts are even. I'm just going to squeeze for any drainage from the nipples. There's none. We're going to assess from the clavicular line down to the bra line, from the sternal to the mid-axillary. So we can assess the full breast. We're going to do light and deep palpation down the breast in circular motion with 3 finger pads. While you're laying down, we can do the medial aspect of the breast with light and deep palpation, and then we'll have you turn to your side for the lateral aspect. So if you could turn to your left lateral side just a little bit, and then I'm going to finish your exam of the lateral aspect of your right breast, and I'm also going to listen for any mitral valve murmur while you're on your left side. There's no murmur noted. Perfect. Okay. Then you can lay on that, and we would have you do the same to your left breast, which is just turn and then finish with the light and deep palpation and circular motions. Alrighty, there's no tenderness, there's no abnormalities, there's no lump. As you lay back, we're going to inspect your abdomen, looking for any protrudence or any abnormalities. There's no protruding areas, there's no thrills or anything noted. So we're going to go ahead and auscultate first. Listening for vowel sounds in all four quadrants. I'm also going to listen for any aortic bruits, renal arteries, iliac bruits. Okay. I would like to palpate for any bladder distension, your femoral pulses, and also your inguinal nodes. I'm going to perform some light palpation of the abdomen. Tell me if there's any tenderness.
None.
Also some deep palpation. Tenderness.
None.
I'm going to try to palpate the liver. Can you breathe in? Okay, and check for the spleen. Okay, the spleen is non-palpable. We're going to go ahead and percuss in all four quadrants. And then we're going to percuss the liver span. The liver is about 8 centimeters. All right, now I'd like to do some range of motion in your knees. So I'm just going to have you flex and extend the knee. Perfect. Flex and extend the knee. And then we're going to do your hips. I'm going to do abduction, just so out, and adduction across, and then flex and extend. All right, we'll have you flex the hip and extend the hip, and then adduction towards me and abduction away. Okay, you have full range of motion. I'd like you to take your right shin, heel rather, and go up and down your shin. And then do the same with the opposite. So your shin is in place. All right, perfect. We'll have you go ahead and sit up. We'll do a rapid finger to nose test. If you can put your finger to your nose and alternate. Wonderful. I'm going to tell you 3 words. I'd like you to remember them. Dog, ball, car.
Dog, ball, car.
Okay, you remember those and you're going to repeat them in a few minutes. I'd like you to count back from 100 by 7. So start at 100 and subtract 7 and count backwards.
100. 93. 86. 79. 72. 55. 65. 65.
If you were walking and you found a letter, you were going to the post office and there was a stamped letter on the sidewalk by the drop box, what would you do?
Turn it to the mailbox.
Put it in the mailbox. Perfect. Can you remember the 3 words that I said to you?
Dog, park, beach.
Go ahead and stand up. We're going to check your gait. I'm just going to have you walk from heel to toe towards me. All right, and turn around and have you walk back. While you are walking, I'm looking at the symmetry of your hips and your shoulders. Okay, perfect. And then I will have you just stand there with your eyes closed for a moment. Perfect. And then if you could touch your Assess your spine for any scoliosis, lordosis, kyphosis. Okay. And could you stand up? And then I'll have you lean back some and side to side. And I believe that will conclude